I'm just briefly going to state
Yeah.
what I understand the reasoning to be.
Okay.
Okay, and you correct me if I'm wrong. That while PSA testing may identify people who do have prostate cancer, including people who would ultimately die from it, it also catches a whole lot of other fish in the net. And in many of those cases, people get caught up in it that their cancer would never grow. It would never prove fatal to them or detrimental to them in any way. And yet they wind up going through biopsies.
Yeah.
Like some of them, like me, wind up with infections and in the hospital.
Yeah.
Some of them wind up with surgery, and you never know 100% for sure. Yep, that cancer would have killed that dude.
Yeah.
You know, and so they went through all of that, and they wind up impotent or incontinent or whatever, and their whole quality of life is impacted, and it never had to happen. And the task force, just looking at numbers to treat,
Sure.
you know, they concluded, look, the numbers aren't there. There's too much risk of harm compared to the promise of health, of help. And so we therefore recommend we don't do that. Do I understand it?
Yeah, basically, but one of the things that, globally, it's hard for me as a physician to say that saving lives will never have a cost to it. Saving lives always has a cost to it. And surgery is certainly as much an art as it is a science. And if you put those two together, it means that we do our best to help as many people as we can. In the process, there are going to be people whose outcomes aren't as good as we would like, and some people who go through operations who probably don't need to. General surgery, I remember from my days in general surgery, the general feeling was, if 100% of the appendixes that you took out had an infection in them, then you weren't taking out enough appendixes, because essentially there's about, if I remember correctly, and I could be wrong, it was something like 10% or 30% of the time is an acceptable number to go in for an appendectomy and find a totally normal appendix. And that general sense of, over-treating some individuals is worth the benefit that you give to those folks who truly require it. And I guess the only issue that I would take with this publication is two things. One, when we look at PSA testing, the absolute value of a PSA is far less valuable than the interpretation of that value and the ability to look at that PSA over time. So PSA as a snapshot in time is certainly not as useful as a PSA dynamically over a period of time. And that's not as useful if
you're looking at trends.
Correct. Trends over time are far more important than a snapshot. A movie tells you far more than a picture. And likewise, as you add information, as you add a Gleason score, as you add the volume of disease, as you add the person's physical health, as you add their age, as you start to plug that into nomograms, as you add CAT scans and bone scans, as you add information, and there's even emerging tests from companies like Orion that are now looking at the level of the cell, saying, we believe based on these characteristics that these things make for a more aggressive tumor. So although the Gleason score may be this, if we look at it in the context of volume of disease and PSA and this, what the cell looks like, we believe this is the likelihood that this is going to become harmful in the future. So I would agree that a PSA number, a single number, has limited value. But I would argue that the PSA test, in conjunction with a lot of other information, allows surgeons, allows urologists, allows practitioners to make an informed decision. And in the end, the person interpreting the PSA is just as important, if not more important, than the PSA value itself.
How does that help the patient? I mean, how do we know who's the good interpreter and who's the not so good one?
Yeah, I mean, that's the challenge that all patients face. I mean, you would like to think that all physicians, all family practitioners, all internal medicine doctors, all urologists have an equal amount of knowledge when it comes to PSA, and obviously that's not the case. There's a great variation in terms of people's individual knowledge bases, those areas that they excel at and those areas that they refer to other practitioners. And as a physician, I would like to believe that those people who have chosen to focus on a different area of medicine as their area of specialty or as the area that they focus on in their own practice, as they come upon things that aren't within that area of specialty for them, that they refer to those individuals who really do have a broader knowledge base. Certainly urologists fall into that group of folks who look at PSAs all the time. A urologist should be able to look at your PSA and say, you know what, this really is not something to worry about right now. I would check it in 3 months. Or, you know what, this trend is worrying me. I think it's worth the small risk of an infection to get a biopsy. And then once the biopsy comes back, they should be able to look at you and say, you know, based on your PSA, your age, your medical condition, based on these scans, based on your Gleason score, here's the options that are available to us. You know, one of which being watchful waiting or active surveillance, one of which could be radiation, one of which is surgery. They go through the options with you and say, these are the risks and benefits associated with each treatment given your case, and help the patient to come to an informed decision.
Does it make any sense to you at all, the task force recommendation?
I guess it's difficult for me to say whether it makes sense or not. What I can tell you is that to recommend that ignorance is bliss when it comes to cancer is not a statement that I agree with. I think that being informed is important. I believe that what you do with that information determines whether or not you go through an unnecessary procedure or not. If you get the right information and you utilize it properly, there should be a very small number of individuals who receive the wrong treatment. But medicine is an art. It's not a science. There's nothing we can do that can guarantee 100% of anything. So the best we can do is take the information we have, use it to the best of our knowledge, and really provide the patient the best treatment possible.
Your recommendation is that people continue to get PSA testing.
My recommendation is that you continue to get your PSA testing, knowing that the PSA is only one factor of many in determining whether or not you should have a biopsy. And if you're diagnosed with cancer, treatment, and any one treatment, is only one of many options that are available to patients. And the most important thing that I think people can do is to become informed. And becoming informed means getting your PSA. If you have a diagnosis of cancer, get multiple opinions, learn about all the different options, and make an informed decision. I don't think a lack of knowledge is the right thing when it comes to prostate cancer.
I want to be a devil's advocate here, and this is almost an insulting question, but I hope you will deal with it. You know, if people in general were to follow the task force recommendations and nobody got PSAs anymore, that would cut into the business of urologists and surgeons in that field, would it not?
It would cut into our ability to save more patients' lives. You know, data has shown that PSA testing has reduced the mortality from prostate cancer. So in the era before prostate cancer, in the era before PSA testing that was done, I'll say it again. So in the era before PSA testing, patients were typically diagnosed at a point that either they were never going to die of their cancer or there's nothing we can do about their cancer. It didn't provide us a large opportunity to be able to cure those folks that sit in the middle. And PSA testing provides us that opportunity.
And so, back to the risk-benefit thing, then you're really saying it is worth people getting unnecessary surgeries. It is worth people getting infections from biopsies.
I think if we look at the people that are cured by prostate cancer, and you know, I've had patients as young as in their early 30s who clearly, if they hadn't gotten PSA testing, they wouldn't have seen their kids graduate from kindergarten, let alone grow old with their wives who they love. So to see those individual lives that are impacted by PSA testing, it's very difficult for me to say that any certain number of lives isn't worth it.